Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX Peer Review Lesson 29. We're going to be doing priority nursing and delegation questions. As always, you guys can follow me on Facebook, Instagram, and TikTok to get any updates. All links will be in the description. Without the way, let's get started.
Question 1. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse check first? A. A client on a ventilator. B. A client in skeletal traction. C. A postoperative client preparing for discharge. D. A client admitted on the previous shift, who has a diagnosis of gastroenteritis. The correct answer is A. A client on a ventilator. Rationale: the airway is always a priority, so the nurse first checks the client on a ventilator. The clients described in options B, C, and D have needs that would be identified as intermediate priorities. Question 2. The nurse employed in a long-term care facility is planning the client assignments for the shift. Which client should the nurse assign to the unlicensed assistive personnel? A. A client who requires a 24-hour urine collection. B. A client who requires twice daily dressing changes. C. A client who is on a bowel management program and requires rectal suppositories and a daily enema. D. A client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. The correct answer is A. A client who requires a 24-hour urine collection. Rationale: the nurse must determine the most appropriate assignment on the basis of the skills of the staff member and the needs of the client. The assignment of tasks needs to be implemented on the basis of the job description of the individual's level of clinical competence and state law. Options B, C, and D involve care that requires the skill of a licensed nurse. Question 3. The nurse employed in an emergency department is assigned to assist with the triage of clients arriving to the emergency department. The nurse should assign priority to which client? A. A client complaining of muscle aches, a headache, and malaise. B. A client who twisted her ankle when she fell while inline skating. C. A client with a minor laceration on the index finger, sustained while cutting an eggplant. D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. The correct answer is D. A client with chest pain, who states that he just ate pizza that was made with a very spicy sauce. Rationale: in an emergency department, triage involves classifying clients according to their need for care, and it includes establishing priorities of care. The type of illness, the severity of the problem, and the resources available govern the process. Clients with trauma, chest pain, severe respiratory distress, cardiac arrest, limb amputation, or acute neurological deficits, and those who sustained a chemical splash to the eyes, are classified as emergent, and these clients are the number 1 priority. Rationale continued. Clients with conditions such as simple fractures, asthma without respiratory distress, fever, hypertension, abdominal pain, or renal stones have urgent needs, and these clients are classified as the number 2 priority. Clients with conditions such as minor lacerations, sprains, or cold symptoms are classified as nonurgent, and they are the number 3 priority. Question 4. The nurse is assigned to care for clients. When planning client rounds, which client should the nurse collect data from first? A. A client scheduled for a chest X-ray. B. A client requiring daily dressing changes. C. A postoperative client preparing for discharge. D. A client receiving oxygen, who is having difficulty breathing. The correct answer is D. A client receiving oxygen, who is having difficulty breathing. Rationale: the airway is always a priority, and the nurse would attend to the client, who has been experiencing an airway problem first. The clients described in options A, B, and C would have intermediate priority. Question 5. The nurse has delegated several nursing tasks to staff members. Which is the nurse's primary responsibility, after the delegation of the tasks? A. Document that the task was completed. B. Assign the tasks that were not completed to the next nursing shift. C. Allow each staff member to make judgments when performing the tasks. D. Perform follow-up with each staff member regarding the performance and outcome of the task. The correct answer is D. Perform follow-up with each staff member regarding the performance and outcome of the task. Rationale: the ultimate responsibility for a task lies with the person who delegated it. Therefore, it is the nurse's primary responsibility to follow up with each staff member regarding the performance of the task and the outcomes related to implementing the task. Not all staff members have the education, knowledge, and ability to make judgments about tasks being performed. The nurse documents that the task has been completed, but this would not be done until follow-up was implemented and outcomes were identified. It is not appropriate to assign the tasks that were not completed to the next nursing shift. Question 6. The emergency department nurse receives a telephone call and is informed that a tornado has hit a local residential area and numerous casualties have occurred. The victims will be brought to the emergency department. Which should be the initial nursing action? A. Prepare the triage rooms. B. Activate the agency emergency response plan. C. Obtain additional supplies from the central supply department. D. Obtain additional nursing staff to assist with treating the casualties. The correct answer is B. Activate the agency emergency response plan. Rationale: during a widespread disaster, many people will be brought to the emergency department for treatment. Although options A, C, and D may be components of preparing for the casualties, the initial nursing action should be to activate the emergency response plan. Question 7. A client has passed away, and the wife of the client tells the nurse that the client is an organ donor and that his eyes are to be donated. Which action should the nurse take next? A. Place dry, sterile dressings over the eyes of the deceased. B. Call the National Donor Association to confirm that the client is a donor. C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. D. Ask the wife to obtain the legal documents regarding organ donation from the lawyer. The correct answer is C. Close the eyes, elevate the head of the bed, and place a small ice pack on the eyes. Rationale: when a corneal donor dies, antibiotic eye drops may be prescribed and instilled. The eyes are closed and a small ice pack is placed on the closed eyes. The head of the bed is raised to 30 degrees to prevent edema. Within 2 to 4 hours, the eyes are enucleated. The cornea is usually transplanted within 24 to 48 hours. Option 1 is incorrect because dry dressings are not applied. Some organ donation protocols indicate using normal saline moistened gauze. Option 2 is not an immediate action. In addition, the client should have a signed donor card, living will, or an organ donor identified driver's license stating his or her wishes. Additional legal documentation should not be required. Agency procedures regarding donor care should be followed. Question 8. A client tells the nurse about deciding to refuse external cardiac massage. Which should be the most appropriate initial nursing action? A. Discuss the client's request with the family. B. Document the client's request in the client's record. C. Notify the healthcare provider of the client's request. D. Conduct a client conference to share the client's request. The correct answer is C. Notify the healthcare provider of the client's request. Rationale: if a client decides to refuse external cardiac massage, the appropriate initial action is to notify the healthcare provider, because a written do not resuscitate prescription from the HCP must be present in the patient's chart. The DNR prescription must be reviewed or renewed on a regular basis per agency policy.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.